Welcome to Case Stories by Dr. Josie. That's me, where you get to hear and learn stories from the hospital. Today we're going to be talking about doctor confessions from Reddit. So I'll be reading different scenarios from different doctors and how they dealt with their patients, the lies they faced, the conditions they faced, and some of them they're crazy. Actually, when compiling this, I was just laughing all through, so enjoy. By the way, I post this kind of stories from hospitals, so if this is kind of thing, kindly consider subscribing. Okay, so our first case from Douglas. This is third hand from 20 years ago. Woman gets a prophylactic double mastectomy for genetic reason. That means that was taken, both of the breasts were cut. So they decided to keep her nipples for future reconstruction. So in such scenarios, you find, especially in cancer, when there's breast cancer and the only option is to remove the breast, later on you can put an implant as a reconstructive procedure. So this is what the woman was set to do. So they implant the nipples down at the bikini line to allow this area to heal. But she never came back for the reconstruction. So somewhere out there, there's a flat-chested woman walking around with a pair of pubic nipples. Wow. During ER rotation, so ER is emergency, a guy came in with a banana up his butt. It went in too far and he needed medical attention. He swore up and down that he tripped, fell on the stairs, and accidentally sat on the banana. So sad. After we finished the procedure and the banana was taken out, the surgeon at the time came over and said to me, just before he accidentally fell onto the banana, also a condom magically got in the way. So you'll find a lot of rectal foreign bodies in hospitals, and I think from the shame behind the story, you'll rarely get a straight story. Let's continue. There are other cases of rectal foreign bodies, and they come up with all sorts of excuses. And I'm here to tell you, when you are in such a situation, don't be afraid to tell the doctor exactly what happened, or don't be afraid of being judged, because the doctor will find out anyway what happened. So just tell the doctor, even if it's only one, just tell them what really happened so that they can help you and aid in management. The next story, so this one was a funny one. So someone had shot himself through the hand with a stolen gun. And they panicked because the gun was stolen. So he put a stick in the hole where the bullet went through and went to the hospital. So when he was asked what happened, he said he was poked by that stick. But you can imagine a fragile twig being able to go through your palm. But the doctor was able to recognize that this was not a stab from a stick. And this is what the doctor said. It must have been a very fast stick to cauterize the wound on its way in. Here's another one. A girl had a very large lump on her breast that she didn't tell the doctors about. She actually went to the hospital for migraines, saying they were getting increasingly bad. When she was being examined, the doctors found the lump, and they asked her, why didn't you mention about the lump earlier? The lady said that she knew it was going to kill her eventually, but she just wanted to get rid of the migraines because they were giving her a lot of pain in the last months. This is a sad and a little bit of funny story, because with breast lumps, most of them are not cancerous, but many girls, whenever they find a lump, they automatically conclude that is cancerous, and hence don't even seek medical condition. It's like they've given up. But here's the thing, when you feel a breast lump, just seek medical care, because as I've told you, most of the lumps are not cancerous. And also, if it's cancerous and it's diagnosed at a very early age, there is 100% chance of treatment. So anything with the breast, please consult medical care. Here's another one, still rectal foreign body. So I never learned what happened to one poor guy at the hospital I worked at. Person came in with a stuck cucumber up his ass and was told it will take a small surgery to get it out. That is what usually happens. It's usually a small surgery, and if it is very complicated, we may go into minimally invasive procedures like laparotomy and laparoscopy, and if it is much infected, then maybe we can go to open abdomen surgery. But here, because he came at a good time, he was told it will only take a small surgery to get it out. He runs out of the hospital. He comes back a couple days later with now infection and is told he will need surgery ASAP. And as he's being prepped to be taken to theater, he runs out of the hospital again. He never came back. So this is, oh my God, this is Dr. Humorous. Say, he sent a male patient into the bathroom to collect a urine sample. It took him much longer than expected, and the doctor was wondering, is he okay? He later came on with a semen sample, so he misunderstood the urine sample for a semen sample. I think when you don't understand anything your doctor tells you, it is okay to ask. There is no shame in not knowing. Okay. Another one of rectal foreign body. So this one well-dressed, put-together man comes in one day, sweating profusely and complaining of abdominal pains. So the doctor orders an X-ray and thoroughly consulted radiologist, and they could see 2 pool balls up his ass, like the pool ball that you shoot when playing pool. They extract the balls, and the man was okay. When he was asked what happened, the man insisted that he has no idea how they got up there. How did they get up there? I have, this is a psychiatric case. So a man who ate things to hurt and punish himself whenever he felt bad. And he felt bad very often, to the extent, for example, if you gave him a glass of water, he would feel he was putting you out and will feel the need to self-punish. So he would eat coins, nails, buttons, strings, and after a while, he was brought to the hospital because the things were accumulating in the abdomen and causing pain. So the relatives are not understanding what was going on until they were explained to that this is a psychiatric condition. It is called pica, where people eat non-nutrient things with no aim of satisfaction. And as I've mentioned, it's psychiatric. A homeless man with a history of alcohol abuse arrives intoxicated to the emergency department. The blood alcohol level doubles within 2 hours, despite being isolated in his room and having been thoroughly searched for alcohol containers. No one could figure out where this guy is getting the booze from. A resident decides to check the multi-hospital system to try and get more information on the guy, and sees an old note from another hospital mentioning, remove all alcohol hand sanitizers for the patients takes them. So they rush to the patient's room and see the hand sanitizer dispenser on the wall. Upon close inspection, it was empty. That is where he was getting the alcohol from. And it is not uncommon to find alcoholics looking for booze from weird places. So sanitizers have a high alcohol content. If worse comes to worse, they end up looking for weird places. A few years ago, a man came in complaining of a terrible cough, chest pain, and fatigue. I asked him if he had a history of smoking. Naturally, he said no. Around an hour later, on my way home, I stopped to get some food, and there he was, smoking outside McDonald's. You know, when a medic is asking you about your drug use, it is not to judge, but mostly to evaluate how we are going to do dose adjustments of medications, and also know if something that you're using recreationally is causing the symptoms that you're presenting with. But apparently, most people don't accept that they use drugs. So have you ever heard of the condition called Munchausen by proxy. Munchausen, I'm Kenyan, so I'll just pronounce it with my mother tongue be the foundation of my pronunciation. Anyway, Munchausen by proxy, it is a condition where a primary caretaker, particularly a mother, makes a child sick to gain attention. So you will find that this child is not particularly sick, but the mom or the primary caretaker does things that will make the child keep going back to hospital. And mostly this is to gain attention. So here's a similar case. One of my patient kept coming back with her daughter's mysterious illness. The kid was gray, like from head to toe. Her skin had a gray-blue tint. Mother swore it happened overnight and nothing could explain it. So now here's the thing. As medics, there are some spot diagnoses that you see and you can start to think towards a certain direction. The thing with graying of skin is mostly associated with silver poisoning. So obviously the doctor suspected that, and when they did the test, they found out that the child had weird levels of silver. Apparently, the mother was feeding silver powder to her kid for the attention. So this is from a paramedic. A woman was shot. We arrive on scene and she has a single gunshot wound in her right thigh, minimal bleeding, and is standing up and limping while talking to the police. She's very polite and nice and thanks us for coming to help her. She said she was walking in the parking lot of a restaurant when she saw a blue car drive by and someone leaned out with a pistol and started shooting and felt something hit her leg. We helped her to the truck and bandage the wound and give her some pain medicine, and to the hospital we go. She jokes about being in the wrong place at the wrong time. So later on, police found the paramedic in the hospital and told them that this woman had argued with the driver of the blue car, and she went to retrieve a gun from the car and threaten the person she's arguing with. And in the process of retrieving the gun and, that hastiness, she shot herself in the leg. So it was a shame for her to admit that she was the one who had shot herself in the leg. This was confirmed later on when the police went through the CCTV and found this. And self-inflicted gun wounds are not a rare thing also, as you've seen. And most people who own guns and shoot themselves, they don't, I don't know, I think it also comes from shame. They usually don't want to be considered irresponsible with a gun. So they'll not tell you exactly what happened, but will say someone else had attacked them. Or like the scenario I told you of the guy who stuck a stick inside their hand. This is from a urologist. The amount of patients that come in with broken or bruised penis is astonishing. Some are honest. They say they were trying some new sex thing and they miscalculated or got carried away. Then someone turns the wrong way or falls on the bed or the swing or wherever they're using, or took a flying leap to initiate sex and missed. But some of them are adamant that they woke up like that. These are the same people whose wives are out of town, and a woman who is definitely not her is in the waiting room to see if her boyfriend is okay. I can bet urologists see a lot. Another one of a bullet wound. So, guy came into the emergency department with a bullet wound to the foot. The angle was really close to his leg and was pointing sort of outwards. He denied that he knew how it happened and that it must have been a stray bullet. So this is what happened. So the dude totally accidentally shot himself on the foot, and it happens to people who put their guns in their waistbands around here, or people who put their guns in the pockets and don't really know what they're doing or don't care about the safety measures. And it happens more often than people care to admit, as I've told you. So a friend had recently graduated and was working in the A&E, and this is what she found. So a guy came in with a dildo stuck up his ass. That's not uncommon. As I've told you, foreign rectal bodies are not uncommon. What was unusual, however, was the obvious lie that he told the medics. So this is what he said. He was at home minding his own business when the doorbell rang, and when he opened, there were two guys standing there. These guys barged their way into his home, rammed a pink dildo into him, and then left.